Mm. Hello, everyone, and welcome to another audio podcast in the fifth series around the Ztormtronix case review, and this is on an audio podcast on around online Syndromium and connecting conundrums. This is the scientist, and this is another Storm Robotics production. I'm going to be talking today about um, uh, sort of areas of health and research and where things are are could be linked better between different healthcare sectors. Some of the context has been highlighted in part previously in parts of this series and potentially through previous audio podcast series. This is where I'm going to talk a little bit, providing a bit of an introduction, some understanding around electronic patient records or healthcare records, and also then an overview through a summary. And In this context, I'm going to uh, highlight, along with aspects of healthcare research, etc. I will be looking to provide examples around around those different areas of healthcare, namely around, for example, as mentioned before, around for, aspects of uh, health in some regard health literacy and healthcare language, but also in relating to context around different healthcare conditions or condition groups. So to begin with, a bit of introduction. In the UK, healthcare service providers are being encouraged to use sort of online facilities um, in several ways, including um, moving away from you moving away from sort of paper using paper to more online records, and this is nothing new, listeners. Obviously, things have been sort of developing and around this in aspects of healthcare for some time. However, that being said, in line with the sort of online facilities or the areas around the sort of where the internet or not sorry not the internet the around how online spaces can be used and sort of integrated. Apart from that, there's also now more so now than ever before. For example, aspects around sort of offering sort of where there's a more scope where more effort is being made relating to digital sort of aspects surrounding digital health. And then where digital health is concerned, it relates to technology. Where technology is concerned, it then relates to mobile apps or smartphone apps. And then actually parts of healthcare become compromised because the ability and the capacity again for patients to question and gain knowledge and understanding around aspects of their healthcare can become can are somewhat impacted, or they're impeded in a way such that the way healthcare is is sort of actioned by patients generally is that they go along with what health professionals might tell them or help communicate with them, and actually generally patients uh, uh, whether they have access to sort of resources after that, they don't actually sort of question aspects of their healthcare. I'm not saying that's a completely bad thing, but and it's not a terrible thing, but healthcare is one of those areas of areas or parts of individuals where generally speaking, uh, uh, generally speaking, patients, individuals, the public health, public in the public, and where public health is concerned, generally should be prompted to question or encouraged to question, thus to bridge areas, bridge focuses around their own healthcare and their own sort of physiology, etc., etc. Now, digital, some of that context has been highlighted in a digital framework for allied health professionals. It's a publication that was that came out into that was developed in 2019. Now, digital services range from administrative tasks of patient registration, registering patients when admitted into healthcare sectors for different forms of healthcare or treatments. Um, uh, some of that understanding has come out from paper by Wu and Liu in 2017, and then laboratory parameters and investigations, and that coming out from that context is in paper by Edwards and team in 2017, and booking appointments and repeat ordering of certain medicines or aspects of medicines and health, and that's a paper by Agrawal in 2009 sort of highlights that, and two aspects that relate to provision of clinical services such as video or online consultations, and there's obviously excuse me, there's a lot more in the public domain now relating to sort of online or group consultations, and paper by Armfield and team in 2015, and Chowdhury in part highlights that retrospectively, at least relating to multidisciplinary team working, and in the paper by Chowdhury and team in 2006, and so similarly, patients are sort of encouraged to interact and sort of communicate with health professionals, except that most of the way that communication is being had has been sort of one-sided. Whilst there's been that sort of interaction, it has been sort of one-sided, and linking or interacting in that interconnectivity with sort of web portals or online spaces, or even aspects of social media, can potentially bring together sort of more formidable ways to for patients and professionals to be sort of connect and have that sense of joined up thinking with aspects of healthcare that they may require. So there's a paper actually by Rydersh in 2000 and team in 2006, and Nutbeam highlights this some context in relating to health literacy in 2000, in a paper by Nutbeam in 2018. And so that being said, there's sort of ability where patients and carers can share experience to increase shared decision making. And that being said, the way information is shared, it's not empowering unless there's a sort of an evidence base that can actually sort of relate the topics and discussions that might be had in these sort of online spaces, for example, so thus to actually uh, so that health professionals, uh, as well as patients, of course, and those in sort of the public space, get to understand really how they can how they can become sort of more um, uh, empowered through understanding aspects of healthcare. Now, that being now that understanding some of this context, listeners is actually in papered by Edwards and team in 2017. Jane and team have lighted Jane and team in 2008 highlight some aspects related to shared decision making, and Jane and Simoy in 2008 also kind of elaborate on this as well. Now, before getting into the context around electronic patient records or EPRs, I'm going to just highlight a little bit around some context around sort of the sciences, or whether diagnostics or clinical. So advances in sort of diagnostics or even sort of clinical sciences um, uh, um, have allowed sort of smarter ways to ensure that patient care is at its best through a link between laboratory practices and clinical practices that are implemented by frontline practitioners and between healthcare sectors as well. Such sort of diagnostics and aspects of healthcare from a laboratory practice have allowed automation of, for example, serological and point of care for biochemistry investigations, and also hematological, immunological, and sort of microbiological, as well as various other areas of healthcare from a pathology department and perspective. Now, that means that equipment is often designed, or laboratory practices are there to help inform, and where scientists perform across several areas of pathology disciplines, and to again allow more integrative care and practice between what happens in the sort of patient facing, where there's patient facing healthcare professionals versus those who are sort of behind in sort of where laboratory practice is concerned. Some of this context has been published again by Gobinji and team in 2015, and there's a book publication by Pitt and Cunningham excuse me, Pitt and Cunningham in 2009, where they author on some context relating to the healthcare sciences and professional practices. Um, smartphone health has become sort of expansive in several areas across healthcare. However, patients still often have various questions about sort of the laboratory tests and investigations, health sort of healthcare healthcare requirements. Thus, um, um, for example, if there was a previous or a retrospective appointments or times where they were seeing health professionals, and if a particular aspect of healthcare was not seen as to be closured at that point, then a follow-up appointment would look to actually investigate a bit further, and thus where the patient actually gets the best out of healthcare in relating to aspects of communication, but obviously from healthcare practice perspective as well. So thus in relating to any test and investigation results, and also aspects that relate to sort of disease management as well, or healthcare management. So paper by Edwards and team in 2017 highlight that, and there was a paper that relates into how some of that focus in relating to electronic patient records was in works, published works by Stoves in 2010. And now, listeners, I'm going to talk a little bit about electronic patient records, and perhaps give the chronic kidney disease perspective, because in line with some of the previous audios and podcasts, that was the chronic kidney disease theme is is perhaps one of the main focuses, sort of that is best in this regard. So one patient record, electronic patient records facility, is sort of known as patient view, or AKA PV. It has been a pioneering example for patients with chronic kidney disease, at least in the UK, where it serves as an electronic patient record management system for patients in lots of different in lots of different ways, but also in a way that where patients and professionals can access a sort of their tests and investigations, and the results, and any comments that relate to aspects of healthcare to an extent can be identified through PV. Patients can access these things at the leisure of their own leisure, and so thus before and after any particular healthcare visits, with in this context with sort of healthcare professionals who are in areas of sort of nephrology practice. Now, PV was launched in 2000. PV was launched in 2004. The interface gives patients access to live test results and understanding around different aspects of their healthcare related to kidney care practices, and about and relating to sort of treatments and things that they may entail. Apart from Stove's paper in 2010, Phelps' paper and team in 2014 kind of sort of reiterate or highlight the aspects around PV in some detail. PV is available in most UK kidney units or healthcare trusts where there's a nephrology focus or attachment, or sorry, a nephrology catchment, with up to 75% of patients registered in centres. And I think this paper was published in 2014, so 7 years ago. So from 75%, it may have increased more so, in, in some regard. So one team analyzed, in Phelps' paper actually, in 2014. Phelps and team, in their paper in 2014, highlight that at the time of the PV, at the time of the PV sort of sensors being done. One team analyzed that patients can use up to one team analyzed patient use of up to 4 years. What they did, I'll describe the investigation. What they did was they sort of investigated how PV was being sort of accessed or connected or interacted with over a 4-year duration, and investigated the factors that are associated with the sort of constant or persistent use. And at the time, PV had the census of 11,000, just over 11,000 patients who were using PV, and had registered with PV, the PV electronic patient record facility, from 37 of the UK's 73 nephrology departments, nephrology centres or nephrology departments. And so what they highlighted was that sharing of electronic medical records between healthcare sectors, specialist supports the several renal pathways that require sort of bi-directional communication between sort of healthcare sectors, and mainly in the focus around sort of anemia management or hemoglobin reporting, laboratory parameter results sharing, sort of more generally, and also certain vaccinations, including hepatitis B, and sort of medicines reconciliation, and even aspects around palliative or end of life care sort of pathways. So those things that are sort of talked or sort of focused in around primary healthcare, and where primary healthcare doesn't really focus too much around sort of kidney care practices or nephrology practices, is where PV sort of, and in literature where including Phelps paper and a little bit in a paper by Stoves as well, highlight that those are sort of the entities where PV could have more has in one way there is opportunity to link aspects of those services and healthcare for patients, so that actually aspects around kidney care are actually better, or at least more smarter, when it comes to where patients and professionals can envisage more sort of aspects of integrative practice. So long-term conditions do not affect all population groups equally as well. So people living in deprived areas are more likely to have multiple long-term conditions than those in the least deprived areas, and an onset of long-term conditions is around 10 to 15 years earlier as well. What this means, in a paper by Barnett and team in 2012, they highlight that in sort of those sort of impoverished areas, and where there is sort of a sense of decline and poor access to resources, generally, where versus sort of the more sort of middle class areas and higher class areas, and irrespective of ethnicity as well, in some regard, basically where these long-term conditions are concerned, 10 to 15 years is how is in work by Barnett and team in 2012 highlight that these are the in those deprived areas or impoverished areas, the people are likely to, it's probable that people in the public will have certain areas of health concerns 10 to 15 years earlier than those who are in, for example, middle class to sort of the higher class population. In this context, the statutory duties to promote or integrate care into health, and there is a framework, a sort of a framework, and Health and Social Care sort of Act in 2012, sort of where that highlights that is important to have integrated care created sort of between healthcare sectors to improve quality of care and to reduce inequalities and in health. And the second of these must not be forgotten. So thus it is core purpose of integrating services when considering how there is perhaps a more spread of sort of health concerns across different populations and health. So so I'm now going to provide an overview or summary in this context. Despite some progress, healthcare in at least in England has in excuse me, in part has excuse me, in part has improved, but in England remain poorly designed in support with people with long-term conditions, where 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 aspects of access to resources can still be quite challenging. And as the King's there's the King's Fund, and where Ham and team in 2012 actually highlight that this is has been the case, and in several others have debated that, for example, where there has been improvements, that actually the barriers where there's been inequity potentially, and impoverishment and disparity, for example, in areas of healthcare, that actually things have improved. And a paper by Aiden in 2018 highlight some of that content, some of the understanding around that, and that those with long-term conditions are in contact with multiple health professionals, and are more likely than those with a single condition to report care and report aspects of healthcare and coordination of problem and coordinate aspects of any issues and concerns, um, uh, areas of issues and concerns, um, um, because of the way that there's on the one hand there's continuity of health, of aspects of healthcare, but on the others, on the sort of inferred side is that there uh, um, patients can feel a sense of um, a sense of uh, concern as well, because generally things have become more technological focused, and access to health professionals um, irrespective, for example, of whether sort of appointments can be identified or not, may not actually may not actually uh, um, uh, may have issues trying to get access. So with technology, with sort of certain areas of advances, there is opportunities um, to improve and integrate aspects of healthcare better, but uh, sort of the new scope for models of care need to be explored, and sort of the data or understanding around the evidence needs to be sort of incorporated, such to that, to the extent there's an educational perspective, so that those in the public domain actually can sort of rise to the challenge, or rise to the challenges, rise through the challenges, and can interpret aspects of healthcare and navigate aspects of healthcare, irrespective of the sort of advances that can be in some part hindering, hindering, or potentially be a barrier, but also on the other side, where approach to aspects of healthcare can just generally be sort of challenging between healthcare sectors. So more uh, in that. Uh, so I'm now going to finish by saying that more sort of integration with aspects of of where sort of the digital aspects of either digital literacy or health literacy, and also generally aspects around healthcare through online spaces can be used as can be advantage can be as an advantage when areas of healthcare are linked with those, but also with aspects of educational sort of requirements. So every health professional sort of has an obligation or a duty, irrespective of the training they've had. And so these points are where I'm going to finish on that, listeners. So I'm now going to just give out a few resources for further reading, and listeners can check out these at any time. So there's the paper by Barnett and team in 2012, where they look at epidemiology of multimorbidity and implications of healthcare research and medicine and medical education, and it's a cross-sectional study published in the Lancet. There's again I've mentioned this in the previous audio podcast, but this is a good one. It's a digital framework for allied health professionals, and it was published in 2019. There is the Allied Health Professionals into Action 2017 publication, and that's also available online. There's a paper by Armfield and team in 2015, the clinical use of Skype for which patients and which problems and which settings, a snapshot review of the literature, and that was published in the International Journal of Medical Informatics. There's also a paper by the Department of Health in 2015, where this has been mentioned previously, review of operational productivity in NHS providers, and it was an interim report. And then there's a paper by Edwards, use of primary care online consultation system, by whom, when, and why, evaluation of a pilot observational study in 36 general practices in southwest England. That was published in the BMJ, British Medical Journal, open journal. There is a paper by Jane and team in 2008, raising awareness of chronic kidney disease among South Asians and primary care, and that was part of the ABLE project. It's published in the Journal of Renal Care. There's a paper by Jane and Simioi in 2008, an overview of chronic kidney disease management and continuous ambulatory peritoneal dialysis in the home, and it was published in the British Journal of Community Nursing. And then there is Making the Change. This is a sort of a framework document published some time ago now, in 2001, but it's titled A Strategy for Professions in Healthcare Science, and the paper by Nutbeam and team in 2018 look at health literacy in context, and it's published in the International Journal of Environmental Research and Public Health. There's the publication by Nutbeam in 2000, health literacy as a public health goal, a challenge for contemporary health education and communication strategies into the 21st century, and it's a Health Promotion International journal publication. There is the Rydersch paper in 2006, Rydersch and team in 2006, published on it's a paper developing a facilitation model to promote organization development in primary care practices, and that was published in BMC Family Practice. And there is the Stoves. There's the Stoves paper, which was published, Stoves and team published in 2010, electronic consultation as an alternative to hospital referral for patients with chronic kidney disease, a novel application for networked electronic health records to improve the accessibility and efficiency of healthcare, and that was published in Quality Safety Healthcare Journal. There's the King's Fund report, a vision in 2018, a vision for population health towards a healthier future, and that's published by the King's Fund in 2000, King's Fund website, and it should be available. There's the King's Fund report in 2013 as well, delivering better services for people with long-term conditions, building the house of care. That was published again in 2013, and is available via the King's Fund website. And those are all of the papers I think I want to highlight. There is one more. The paper by Phelps and team in 2014, patients continuing use of an online health record, a quantitative evaluation of 14,000 patient years of access data. That was published in the journal Medical Internet Research Journal of Medical Internet Research, and again that was published in 2014. So yes, so that's where I'm going to leave it, listeners. I hope you've enjoyed this audio podcast in this fifth series of the series around the Ztormtronix case review. This has been on online Syndromium, connecting conundrums, and we've got two more podcasts, audio podcasts in this series, and then that will be series 5 drawn to a close. It's been another Storm Robotics production. Thank you for listening, and I hope listeners get an opportunity to check out some of those resources at their own time. Thanks for listening. Have a good one.